Imbes na, mga kapartner sa business, buksan ang isipan sa mga bagong kaalaman sa negosyo, ekonomiya at hanap buhay. In the heart of business. At ngayon, narito na ang mga kilalang business columnists at broadcasters, Maru Pahati Sarne at Lito Gagni.
Magandang hapon mga kaibigan. Welcome po dito sa In the Heart of Business. Ako po si Maru Pahati Sarne with my partner, Lito Gagni.
Hi, si Lito Gagni. Hi, partner. At maganda po ang ating pag-uusapan ngayon. Yun po yung pinakamahalagang aspeto ng ating buhay.
Tungkol sa ating kalusugan. Oo, tungkol sa ating kalusugan. Totoo yan. Dahil kapag yan nga ang problema natin, pag problema na yung kalusugan, ako sunod-sunod na pati ekonomiya. Malaking problema na, di ba? At ngayon mga kaibigan, ang bisita po natin dito sa In the Heart of Business, ang kauna-unahan na Certified Patient Experience Professional dito po sa Asia. She has been working in the patient experience field for 13 years with a strong background in patient relations management, patient analytics, operations, and strategy. Siya po ay very passionate dito sa lumalaki movement sa patient experience at advocate and active speaker in Philippine healthcare. Nakapagbigay na po siya ng international keynote presentations sa patient leaders dyan po sa ASEAN region at gayon din sa Philippine Physician and Healthcare Organizations kung saan kanya po inuugnay ang clinical care at patient experience. Miyembro rin po ng Global Steering Team ng Future of Experience Measurement with the Beryl Institute, a leading patient organization in the USA. Ang ating pong bisita ay ang kasalukuyang head po, Patient Experience Excellence sa Metro Pacific Health. Wala po iba kundi si Miss Joyce K. Nazario. Hi, Miss Joyce. Magandang hapon.
Good afternoon, Ma'am Malu, and good afternoon, Sir Lito. I'm very happy to be here today.
What is Metro Pacific Health and what will it become here on, Ma'am?
So, the name Metro Pacific Health it's a branding change now. Before we used to be Metro Pacific Hospitals, and now it is Metro Pacific Health. So, we're really going beyond the hospitals and clinics and, moving out into the whole healthcare spectrum, from virtual care, mobile care, home care, the whole spectrum of illness to wellness. In the DNA of our frontliners across the network, we really give compassionate and patient-centric care on top of medical excellence. So, this leads to the brand proposition that differentiates our 19 hospitals, from the other hospitals. We have Makati Medical Center, Cardinal Santos, Asian Hospital, Davao Doctors, of course, in Davao, and Riverside and Bacolod. These hospitals really have it in them that we provide compassionate care on top of excellent outcomes. It's not just about early prognosis, successful surgery, but also in the everyday smaller things that really matter. So the soothing voice of our doctors, the cheerful greetings of our security guards, the humming of the nurses when they push their wheelchairs forward with the patients to soothe them if they're anxious, giving directions very well so that the patients and their families in the hospitals can move around. And even birthday greetings when you're in the hospital, that's all part of what we see as Metro Pacific Health.
Oh, so doon pumapasok, ma'am, yung inyong patient experience excellence.
Yes, of course.
Oo, na inihawa mo doon sa lahat pa na mga kasamahan niyo dyan sa Metro Pacific Health. So, yan po ang dahilan ng inyong pagbabago ng inyong brand name. Kasi naka-attend tayo doon, di ba, partner Lito, sa launch ng kanilang brand equity launch po ng Metro Pacific Health. So, hindi lang ospital ito sa kabuuang pangangalaga po sa kalusugan ng ating mga kababayan, ma'am, di ba? So, ano po ang mga specific na mga plano po ng Metro Pacific Health para mapalawak nyo pa ang inyong network?
Yes. So parang we'll talk about the logo first, no? So it's the visual expression of the heart of Filipino healthcare. Yes. The MPH, no? So it's in the M, the P, and the H. So this is parang it conveys the group's focus on becoming leading and most valued integrated health network in the Philippines. So yeah, the growth scope of our network. We're going to deliver high quality, sustainable, compassionate, patient-centered care. So we're going to build a nationwide network of hospitals. We're going to have outpatient care centers. We're going to have cancer care centers. We're going to have pharmacies, satellite laboratories, and we have allied health colleges now, but of course we will still grow that, no? Again, I'm also talking about virtual care, so virtual care platform where our patients, whether they're, like I said earlier, Sir Lita, no, from Davao, you can access the things that if you go to Manila or to the Visayas, it's going to be together. Mobile care will bring the care of the hospitals into the home for those who need care at home, and really covering the whole spectrum of illness to wellness. So we're really reaching out in the whole end-to-end healthcare service that we can provide to the Filipino. Metro Pacific Health is looking to do that.
Oo. So ito ang inyong brand new logo.
Puso. The heart of Filipino healthcare.
Yan, oo. Okay. Gaano ba karami ang mga ospital ng Metro Pacific, ma'am?
Right now, we have 19 hospitals in the network.
Oh, 19
Bukas 20 na.
Baka bukas 20 na. Malapit na po.
Oo. At lahat
But we do plan to grow.
Oo, iisa ang kanilang layunin, no, na maibigay nga yung excellent healthcare doon sa ating mga pasyente. Itong yung mga doktor po natin, mga nurses natin, sila po ay inyo rin pong tinrain kung paano ang talagang tamang pagtugon po sa pangangailangan ng ating mga pasyente. Oo.
Booming voice pala. Kumusta gano'n?
Pati yung paraan ng makikipag-usap, ha?
Opo. As I say, touch points matter kahit in the manner of speaking. The manner of speaking, it's there. Kasama po yan sa touch point. Every time you get to interact with the patient, whether it's in person, and the way the hospital looks, the way the hospital smells, the way that the doctors interact with the patients, all of those are different touch points.
Oo, kasi alam mo yan ang mga sensitive kasi ang mga pasyente, di ba, ma'am? Na siyempre may mga masakit sa kanila. Ngayon, kung kunyari papagalitan mo sila lalo, di ba parang mas lalo silang sumasama ang loob at feeling nila, bakit ako ginaganito? Lalong hindi gumagaling tuloy. So pati yung mga bagay na yan ay yan ang ibibigay na quality ng Metro Pacific Health. So yes, ma'am. So ano pa po ang inyong pamamaraan para yung the heart of Filipino healthcare ay maramdaman nitong ating mga pasyente at ng kanila mismong mga pamilya rin?
Well, doon talaga po pumapasok yung patient experience, no? And one of the campaigns that we're really doing right now is called the I'm Here campaign. So it's something we say to our patients pagdating po na sa ospital. My name is Joyce Nazario. I'm here to take care of you. It's a commitment. Kasi when you say it out loud, it's a commitment. Pag sinabi nyo po, kailangan pong gawin, di ba? So pag sinabi po ng bawat kasamahan natin po sa ospital na I'm here to take care of you, aalagaan ko po kayo, kailangan po maalagaan nyo po mabuti yung mga pasyente at kanilang mga pamilya. So that's one. Tapos po, across the network po, there are a lot of digitalization plans. So like as I talked about the virtual care platform where patients can access their medical records, book appointments, just be in touch, schedule their different face-to-face and virtual appointments as well. The same thing also for patient experience. There are projects coming up in terms of digitalization. Like we're going to make sure that we're able to get what we call the voice of the patient, no? The voice of the patient through our digital means. Our different patient feedback tools. Meron pong ganyan. We also have. Yes, opo. Tapos we make sure, because of course we belong to a network that we want to do things evidence-based. Nasa medical field po tayo. We make sure that, the different tools we're using are very good. So we're going to use a lot of digital tools as well.
Mm-hmm. Okay.
Ganda na yung programa. Partner, alam mo, I think in a sense, yung Metro Pacific Health, naka-benchmark sila doon sa top ng hotel activities. Ganyan. Di ba? Siyempre sa hotel, di ba? Parang hospital pero
parang hotel ang feeling. Oo.
Parang hotel ang feeling. Maganda. Yung hello, gano'n, di ba?
Oo. At saka pati yung quality ng mga kwarto, di ba? Na mabango, malinis, at saka parang ang hotel, hindi ospital. At saka siguro yung nagpo-provide din ba kayo ng entertainment doon sa inyong mga pasyente?
Kung may gusto, di ba?
At saka yung mga family, so
Of course, we're going to make sure na, even in the room, there are possibilities for entertainment. Alam naman po natin sa other hospitals, they have the available smart TVs, and we're making sure that the environment in each hospital is good. Many of our hospitals already have what we call, the seasonal or the seasonal activities that we do at Christmas and Valentine's Day and Mother's Day. Wow. You really take account in all the holidays and occasions. And that's something that you see even right now. And of course, we're going to enhance that as well, to ensure that we really prioritize what the patients want the most and need the most. I think that's the most important.
Oo.
Ang galing.
Oo, pati yung provision ng mga pwede nilang puntahang restaurants, di ba? Nandoon din. Doon sa inyong mga ospital. Kasi palaki rin yan. Factor para doon sa mga...
Magkatipid, magaganda yung mga
restaurants nila.
Hindi masyadong yung mataas, mahal. Hindi, tama lang. Yung nanay ko nga doon, 92 years old.
The famous floating island po. The famous floating island ng Makati Medical Center.
Nandun. So talagang siniguro nyo na lahat ng aspeto ng serbisyo mayroon para sa mga pasyente at saka sa kanilang pamilya na nagbabantay sa kanila. Ngayon, sa panahon po ng COVID-19, paano nyo po ina-address yung sitwasyon ng yung bukod po dun sa privacy, yung pangangalaga para masiguro na hindi kakalat po ang sakit?
So of course, because in all of our hospitals, safety is always the priority. In any healthcare institution, safety has to be number one, and all of our hospitals are the same. So we have always the proper checks before our patients come in. We have the different HEPA filters. You see them all around. It's important that in every aspect of their movement to the hospital, all the different international safety standards are followed, whether it's the cleaning, whether it's the social distancing. Again, the PPE is always present, the way we screen our patients and their companions when they come in. We really give the highest level. And again, we have a lot of accreditations, international accreditations, and all of those international accreditations are followed. We have Joint Commission International Accreditation Canada. So that we know that all of these standards to keep our patients safe in the time of COVID, but also any other time of the year, we follow those standards.
Mm-hmm. Ano pa po mga innovations ang inyong ginagawa dyan sa Metro Pacific Health?
Well, I think for me, really, the most important part would really be digitally transforming the healthcare landscape. We're exploring remote patient monitoring. We have electronic health records, hospital at home system. Yes, electronic health records across the system. So across the 19 hospitals, plus the other outpatient care centers, hospital at home programs, and these will really revolutionize patient care in the country. It's really bringing healthcare to where you are. Healthcare to where the patients are, And again, I'll talk again about the new virtual care platform. This will really upgrade our hospital information systems. And it's what we call the integrated digital access point, all in one. You all meet in one place, and you're capable to search for and schedule appointments. You virtually triage yourself. You go to the right site. So from where you are, it's easy to find the hospital you need to go to kung saan malapit po sa inyo. And again, and access medical records wherever you are across the network.
Yung mga pasyente, mas madali nyo mapupuntahan, di ba? Kahit nasa kanilang mga bahay sila because of this digitalization. So napafollow up nyo rin kung ano ang nangyayari doon sa inyong mga pasyente.
Opo, ma'am. That after hospital visit, the post-discharge care is very much an important part of, especially patient experience. Now, that's one of the things that we really focus on because the care doesn't end in the hospital. It's really, again, across the whole continuum of healthcare, from the time they're aware of the need for healthcare until the time that they are well again and coming back to the hospital just to make sure that they're well, to upkeep the wellness, not necessarily treating a disease, but making sure that they continue to stay well. That's also part of our, our vision.
Ako, partner, meron na akong app na MWell.
Yes,
hindi ko pa nagagamit.
Yan pa,
hindi ko alam paano mag-navigate. Basta nakapasok ako. Hindi ko na alam.
Oo. So
Oh,
Yes,
kasi
ma'am.
yung I mean that's really the virtual care platform as well, no. It's about the virtual care in one and easy app on your telephone or on your tablet, even on your computer. It's all the same. Easy digital access to your healthcare.
Alam mo, partner, there is something that I noticed with the entry of the Metro Pacific Group to Metro Pacific Health. When they entered the Philippines, they started as Metro Drug. I was then the editor ng 90s sa Chronicle. And we were able to sit for dinner with MVP. At that time, parang merong chairman's club ata, president's club. Kung hindi ka presidente, hindi ka pwede doon. Parang ganun. Yan lang kami. We were, treated by MVP. Tapos Metro Drug, and then afterwards, Metro Drug, medyo nagbago. Nagbago sila ng business. Then they are now back to Metro Pacific. Ang ganda. What can you say about this, Ma'am Joyce?
Well, the return, yes, the return. It was very timely, though, because our president, Sir Audrey Polisok, was telling us in the history of Metro Pacific Health is that they really started when Makati Medical Center got to talk to them about helping them out in terms of the business operations. That's where it really started, and then the passion again to be back in healthcare. That's where it grew, and from one hospital in 2007, oh my gosh, it expanded so quickly to what we have now is 19 hospitals.
19.
And, just a number.
At hindi lang
of
sa
years.
Metro Manila, no? Pati sa mga probinsya. Yeah?
Yes, we have 4 hospitals in Mindanao and 2 hospitals in Visayas as well.
Tama. At saka nakakagulat doon, partner. Ang Makati Med, bali 750 million yung kanilang utang na pinick up ni MVP.
Yeah.
And then napaganda nila. Because at that time, parang hindi naman pala magandang business proposition ng hospitals. Mas maganda yung ginawa niyo. Siguro dyan nga dahil may patient care, may mga initiatives na ginawa kayo para mapaganda ang negosyo.
At saka yung quality na social pero affordable, di ba? Yun yung
puso.
Kasi may puso kasi.
May puso kasi, of course, Metro Pacific. Well, I would say that Makati Med and all of our other hospitals as well. No, we already have what the medical excellence. We have that Makati Medical Center again, Cardinal, Asian Hospital, Davao Doctors Riverside. We have that medical excellence. It's really about, and of course we all know that the MPIC, so Metro Pacific Investments, is really one heck of a business group. No, they really know how to transform, and of course the vision of of MVP, of course, Sir Oji at the time, the vision to really transform what was already a very good product in the beginning to something bigger, and now amazingly bigger. The scope is so much wider, and of course with the whole management team that we have now at Metro Pacific Health, and of course the support of friends like you in the media, with the different sectors, the government, the private business sector, because it's not just about Metro Pacific Health as a business. No, we want to, and MVP said this, we want to contribute to nation building. We also provide affordable, high quality, and accessible healthcare through our 19 hospital network.
Oo, yun ang sinabi ni MVP nung kanyang speech, yung tungkol sa ang isang malusog na nation ay malusog na ekonomiya. Yan ang yan ang kanyang paniniwala. Oo.
He opted to take the road less traveled, sabi niya. Favorite niya si Robert Frost.
Yes. I felt teary-eyed because I'm a big believer in we are who we are as a healthy nation. If we're healthy, the nation, diba, if we're healthy as a Filipino, then the whole nation is healthy in many other aspects as well.
Okay. Oo. So ma'am, paano naman yung pakikipagtulungan nyo sa gobyerno? Are you also working with the government? Kasi syempre they have this PhilHealth, no? Para doon sa mga kababayan natin na makayanan yung kanilang hospitalization. At ano pa yung iba yung pakikipagtulungan sa ating pamalaan para maisulong nga ang isang healthy nation?
Oh, yes. Actually, right now, our CEO, Dr. Harish Pillai, is a member of the Private Sector Advisory Council for Health.
Oh.
So he is really active. He's really active. Of course, he's very active in that. He's going to bring his international expertise, to this council, and of course to our network. He's already right in the middle of it. But yes, we really have a seat at the table in terms of transforming the nation in terms of healthcare, and going to not only be here as a network, but to share knowledge, contribute in terms of CSR. Those are also in our plans.
CSR. Wow. So what are the CSR initiatives you're doing right now, and what will they be next time?
Right now, we're building the CSR program. But, as you know, even before, during the pandemic, there are a lot of activities that the Metro Pacific hospitals already contributed in, from the vaccinations, from disaster relief. We're just going to make it wider and more efficient because of the network, the way we're doing it as a network. No, there's so many things that we can contribute to. In terms of CSR, for those Filipinos. Well, one of the things already is providing affordable and accessible care, where you have the quality of the best hospitals, but, anyone can have that care. We don't want the Filipino to leave the Philippines for complex cases. No Filipino should be deprived of quality health care. We believe.
Wow. Galing, you keep the heart beating. All of us.
Yes. So,
our heart beats for the Filipino people.
Oo nga. Yan ay isang malaking pasasalamat ng mga kababayan natin Pilipino na may ganitong uri ng ospital. At nawa ay tularan ng iba pang mga hospitals yung kung paano kayo nagsisilbi para sa ating mga kababayan. Dahil sabi mo nga, Miss Joyce, hindi lang naman yan yung pagpapagaling mismo ng sakit kundi yung continuing care sa kanila. Diba?
Yes.
Kahit na nga nasa labas na sila ng inyong ospital.
Yes, Ma'am.
That is very great po. So, bilang panghuli, Ma'am, ano po ang inyong masasabi pa at may dadagdag dito po sa ating talakayan ngayon?
Siguro, I just like to reiterate that we want to ensure that affordable, high quality, and accessible healthcare through our 19 hospitals. Again, I'll name some of our hospitals: Makati Medical Center, Asian Hospital, Cardinal Santos, Davao Doctors, Riverside, and many of the other NCR and Mindanao hospitals that are part of the network. We want to ensure that no Filipino leaves the Philippines for complex cases. No Filipino will be deprived of quality health care. And siguro to sum it up, what is the heart of Filipino healthcare? This is what we believe in the network, Kindness is where we start. Filipino service that comes from the heart. While our standards are global, our touch stays personal. So we are Metro Pacific Health, the heart of Filipino healthcare.
Galing. Bravo.
The heart of Filipino healthcare. At ang focus talaga ay ang mga pasyente. Yan, okay.
Tumakal ng puso ko, lumukso.
Oo nga Para tulong.
About it, my gosh.
Parang, kahit ayaw mo ma-ospital gugustuhin mo na tuloy ma-ospital dahil doon sa ipinapakita nilang, ipinapakita nilang.
Sabi nga nila, kindness is its own reward.
Totoo.
Ang galing
Executive check-up lang po. Yun lang yung reason. Sana pumunta kayo.
Magpapacheck-up lang tayo. Hindi tayo lang.
Pupunta ako dyan, Ma'am Joyce, Pupunta ako dyan. Unannounced, pwede?
Of course, syempre, sir. Ako po sasalubong sa inyo, sir, dito.
Siya ang babate.
Maglalakad ako mula MRT Ayala hanggang dyan sa may baba ng sa walkway. Bababa ako pasok. Pagod ako. That's 30 minutes kasi.
Opo. Kasi at the end po yung Makati Medical sa dulo po na.
Ang galing. I really like, these kinds of programs. Maganda yan. Yung local, yung personal, yung global standards. Galing ninyo.
Thank you, sir.
Anyway, Miss Joyce, maraming salamat at kami ay nabigyan ng panibagong pag-asa na kapag na-ospital ka, hindi kailangan matakot ka. Kasi alam mo, maliligtas ang iyong buhay, maaalagaan ka pa, di ba?
At saka
Salamat.
masaya ka pang nandun. Kasi,
Kaya nga, para ka
busy
nag-staycation. Staycation, di ba?
ko lang eh. Meron kang boses na kumusta na? Sabi, no.
Our patients deserve it po. Our patients deserve it.
Yes. Patient Experience Excellence Head ng Metro Pacific Health, si Ms. Joyce K. Lazario. Ms. Joyce, maraming salamat. Thank you so much.
Thank you. Thank you, Ma'am Malu. Thank you, Sir Lito.
Oo, at salamat din sa lahat ng ating mga kasamahan dyan sa Metro Pacific Investments Corporation. Siyempre, kasama natin sina Maven Panganiban, Magic Bautista, si Miss Melody Del Rosario. Maraming salamat din po. Okay, thank you so much. Bye!
In the Heart of Business.
TV ng Metro Pacific Health, no? At ano ba ito? Binablock ba ng Facebook? I think sila ang may copyright naman yan nitong song na ito, and they asked us to air it on DWIZ. I don't know if Facebook is blocking us, pero mga kaibigan, yun po yung MTV po mismo ng Metro Pacific Health, kasi nag-rebrand po sila, nagkaroon ng brand equity launching last Wednesday, no? Wednesday of last week, October 12, at dumalo po tayo ng ating partner na si Dito Gagni para masaksihan ito pong launching po nila ng kanilang bagong mga ospital, other healthcares na kanila pong isinisilbi ngayon sa mga mamamayang Pilipino. Ngayon, doon po sa ating interview, no, kay Miss Joyce Nazario, tinanong din po natin yung tungkol po dito sa yung mga ospital po nila, kung ano po yung mga services na ibinibigay. Ang sabi nga nila, quality healthcare talaga na hanggang sa bahay nyo na ay susundan pa nila kayo at ipa-follow up kung meron po kayong problema sa inyong kalusugan. Hindi ibig sabihin na porque na-discharge na kayo sa ospital niya, wala na, kakalimutan na nila kayo. Hindi, may patuloy daw na follow-up. At ang maganda nun, may record na kayo sa kanila na kahit saang mang kayong lugar sa Pilipinas napunta at doon sa ospital nila kayo na napasok, ay pwede pong i-pull out yung mga records nyo kasi digital na po ang kanilang record keeping. So, ibig sabihin, by the touch of the computer, malalaman nila kung ano ba ang nangyari sa inyo dun sa kabilang ospital nila at bakit kayo na ospital ngayon uli. Makikita rin nila kung may mga allergies kayo or whatever. Hindi na kayo kailangan i-test pa dahil meron na po kayong file doon sa iba nilang ospital. So, yun ang maganda po dito sa kanilang digitalization. Sana mangyari rin yan, no, sa lahat ng mga ospital din ng gobyerno. Gayahin din sila. At saka iba pang mga ospital, sana nga magkaroon ng interconnection para ipupull out na lamang through computer ang inyong pong mga file. Or probably PhilHealth can do that, no? Na sila na ang may file po ng inyong health details. Okay? Anyway, sige, i-play natin uli. Ito po yung MTV ng Metro Pacific Health na nilikha mismo ng isa pong opisyal ng Metro Pacific Investments Corporation. Pakinggan po natin, panoorin. Okay. Yan po ang brand new MTV nito pong Metro Pacific Health Group at ang nag-compose po ay isang official din po nila, no? Congratulations, Metro Pacific Health. At tayo nagpapasalamat din na pinagkatiwalaan po tayo dito sa In the Heart of Business na para maihayag yung kanila pong mga impormasyon kaugnay sa kalusugan, sa sustainability, sa ating environment, di ba? At yung iba pang mga proyekto po nila na makakatulong katulad ng mga scholarships ng Metro Pacific Investments Corporation at ng kanila pong mga foundations. Kaya palagi po kayo makinig dito sa In the Art of Business kasi palagi pong may hatid na bagong mga balita na makakapag-unlad pa ng ating buhay. Anyway, maraming salamat din nanonood, nakikinig sa ating ngayon. Sina RG Chell dyan sa China. Walang pugay, walang patlang. Thank you, RG Chell. At saka si Mr. Sydney, si Engineer Alvin Quinto, palagi rin siya nakatutok dito sa atin, listening from Sydney State Government, Department of Planning. Ang galing naman ni Engineer Building Certifier Alvin Quinto. Magandang hapon po. Si Preslyn Cruz Garcia, hello. My sister, nandiyan naman siya sa may Cavite. Hello rin sa iyong mga anak at sa iyong husband. Hello sa lahat ng mga tiga-Imus Cavite na nakatutok sa atin. Tsaka may nag-message sa akin kagabi. Sabi niya nanonood at nakikinig daw lagi. I think Gloria Santos, yung kanyang pangalan. Hindi ko makita. Pero palagi rin siya nakatutok dito sa atin, hindi lang siya nakakabate. Ayun, tama nga, Gloria Santos, hello, magandang hapon. Lori Santos din, at saka si Dean Santos, thank you. And Ate Liza Aquino, maraming salamat. And salamat nga rin pala sa ating mga kaibigan po kasama dito sa DWIZ. Yung nauna po sa atin, tambayan sa DWIZ, sina JP Varela at saka si Attorney Ahmed Paglinawan, lagi din sumusuporta sa atin dito sa In the Heart of Business. At ngayon naman, siguro panoorin natin yung Corporate AVP po ng Metro Pacific Health. Narito po yan.
There's no limit to what we can do when our hearts care with compassion. In 2007, what started as a man's response to help one hospital led to a vision to improve the lives of Filipinos through quality healthcare. Over the last 15 years, we saw how a single hospital grew into a network of 19 hospitals all over the Philippines. Makati Medical Center, Davao Doctors Hospital, Cardinal Santos Medical Center, Riverside Medical Center, Our Lady of Lourdes Hospital, Asian Hospital and Medical Center, De Los Santos Medical Center, Central Luzon Doctors Hospital, West Metro Medical Center, Manila Doctors Hospital, Sacred Heart Hospital of Malolos, Marikina Valley Medical Center, Dr. Jesus C. Delgado Memorial Hospital, St. Elizabeth Hospital, Manuel J. Santos Hospital, Los Baños Doctors Hospital and Medical Center, Ramiro Community Hospital, Calamba Medical Center, Commonwealth Hospital and Medical Center. Delivering an array of healthcare services through outpatient care centers, cancer care centers, allied health colleges, pharmacies, and a centralized laboratory. Metro Pacific Hospital Holdings Incorporated is now the first and largest private hospital group in the Philippines. Supported by Metro Pacific Investments Corporation, we have improved infrastructure, procured state-of-the-art medical equipment, offered more affordable healthcare options, built strong partnerships with both the government and the private sector, and expanded our services. All of these are founded on a solid alliance between seasoned management professionals and the best doctors, nurses, and staff in the country. In renewing our commitment to medical excellence and compassionate patient care, Metro Pacific Hospitals has transformed into Metro Pacific Health, the leading and most valued integrated healthcare network in the Philippines. We will invest in new technologies in both medical science and data. Digital transformation will improve the quality and efficiency of care and also facilitate patients' access to it. Imagine a single patient ID for every patient in the interconnected network nationwide, armed with a safe and secure access to one's electronic medical records anytime, anywhere. We shall link up all aspects of healthcare, from treatment to wellness, from the most complex medical equipment to everyday gadgets, from hospital care to mobile care and home care, or wherever you may be. And when disasters and calamities happen, we'll be the first to provide medical aid. As our network expands, we will never lose sight of our most important focus, our patient, keeping them safe and treating them well. Together, we will build a healthier Philippines, one patient at a time. Our dream is for no Filipino to have to fly out of the country for world-class medical attention, for no Filipino to be deprived of high-quality health care. For no Filipino to have to leave their homes for an urgent consultation. For all Filipinos to be cared for with the compassion, kindness, and empathy they deserve. Our vision is to become the leading and most valued integrated healthcare network in the Philippines and one of Asia's most innovative and trusted healthcare providers. With 19 hospitals, 3,829 beds, 22 outpatient care centers, 9,535 doctors, and 16,566 nurses and staff caring for 3.8 million patients. We will provide compassionate and high-quality patient-centric care, unparalleled Filipino service that comes from the heart. Because while our standards are global, our touch stays personal. We are Metro Pacific Health, the heart of Filipino healthcare.
Yan, okay. O, diba? Ang ganda. Sabi nga ni Domingo Pando, ang ganda dyan sa Asian Hospital. One time na ospital ang pinsan ko dyan. Ako nagbabantay. 1 week kami nagstay. Parang ayaw ko na umuwi ng bahay. Para kang nasa hotel. Minsan ako yung pumapalit sa higaan ng pasyente. Ang lambot daw ng kama. Sana ganyan din ang mga government hospitals natin, hindi po ba? Yung magkaroon ng quality health care din sa mga pasyente, kaya naman yan eh. Basta lang lagay sa tama ang mga pondo, di ba? Kayang-kaya naman po yan. Pero ito kasi nga si MVP, talagang nilalagay niya sa tama yung pondo nila, no? Kaya talagang binubuhos niya sa kung saan magiging komportable at masaya ang kanila pong mga pasyente. Kung makikita po natin, lahat ng binili niyang ospital ay nag-transform talaga, nag-develop into something na mas maayos, mas maganda, at saka mas quality rin po ang kanilang healthcare. So congratulations, Mr. Manny Pangilinan, sa kabuuan po ng Metro Pacific Health, kay Miss Iska, Jessica, and of course si Miss Joyce Nazario, maraming salamat. And sa lahat po ng bumubuo ng Metro Pacific Investments Corporation, na partner po ng In the Heart of Business. Okay, before we go, meron lang po akong isi-share sa inyo, no? Kahapon, ang piso po natin ay nagsara sa halagang 58 pesos and 95 centavos. Eto, lumalaban talaga yung piso natin, no? Ayaw niya talagang pahila, papunta doon sa 60 pesos. Hanggang 59 lang usually na siya po ay humihinto sa 59. Maraming salamat Bangko Sentral ng Pilipinas kasi ginagawa talaga nila ang lahat ng magagawa nila. At ngayon ang utos po ni Pangulong Ferdinand Marcos at pati rin sa advice ng kanyang mga economic advisors magkakaroon ng higher interest rates para malabanan din po itong tumataas na mga presyo. Kasi yung inflation na nagigintay lang po ng pagtaas ng presyo po ng mga bilihin at para mapababa po yung inflation, kailangan itaas nila yung borrowing rates o yung interest rates kasi kapag ang mga tao po pinipigil naman nila ang kanilang pera, hindi sila masyadong nagbibili, hindi masyadong umuutang, ay nagiging dahilan po yan para bumaba naman itong mga presyo po ng bilihin natin kasi wala nang bumibili sa kanila eh. So pipilitin ng mga manufacturers sa pababain po ang kanilang mga presyo. So ang borrowing cost po ay inaasahan na mas magiging malaki sa mga susunod na buwan. Kaya kung kayo naman po ay hihiram, kayo po ay mangungutang o kaya kayo po ay bibili ng mga sasakyan o kaya bahay at lupa, gawin nyo na ngayon kasi kapag tumaas po yung interest rates, mahihirapan po kayo sa pagbabayad po niyan. So, ang gagawin po natin, kung meron po kayong mga balakin, ngayon nyo na gawin kasi yan na nga ang sinabi ng gobyerno in the coming months para po mapababa ang inflation rate ay ang interest rates po ang kanilang itataas. Ayan. So, sa ngayon, mga kaibigan, hindi naman po problema lang ito ng Pilipinas eh. Problema po ito ng buong mundo na ang taas po ng inflation rate, kahit na anong gawin po ng mga gobyerno na itaas din po yung interest rates para mapababa yung inflation, wala pa rin magawa. malaking factor po talaga yung giyera pa rin dyan sa Ukraine at Russia at saka itong pagbabanta rin ng North Korea, paputok siya ng paputok ng mga missiles at syempre itong pandemya po na kinakaharap pa rin natin. Hindi pa rin naman tayo tapos dito Akala nyo tapos na. Hindi pa rin po tayo tapos dito sa pandemya ng COVID-19. Patuloy lang siya nanganganak ng mga bagong variants. Although sabi nga nila habang nanganganak siya ng bagong variant, ay bumababa naman daw yung kanyang pagiging infectious at saka mas madali mo na siyang mapagaling dahil nga meron na tayong immunity dito, lalo na kung nabakunahan. At bukod po dyan ay nakikita naman po nila na ang bawat pag-mutate ay humihina rin naman yung kanyang lakas. Pero sabi nga natin, hindi porke ganun, tayo magwawalang bahala na kailangan pa rin maging mapagbantay tayo kasi katulad nitong bagong variant. Sabihin man natin na hindi siya kasing lakas nung Delta at saka nung una yung original strain na Wuhan, pero ito pong bagong Omicron, XBB and XBC variant, nakakamatay pa rin. Kasi recently, doon po sa pumasok dito sa ating bansa, 5 po ang nasawi mula dyan sa variant na yan. Anyway, 1:59 na po in the afternoon. Bago po tayo tuluyang magtapos, ano ba ang kalagayan ng ating stock market? Ayun, ito po ay up ng 3.67 points lang, 6,151.98 points. At sa mga shares po, sa mga industriya, sa mga sektor, industrial at saka holding firms and mining and oil po ang baksak ngayon. At tayo po ay maging mapagbantay dito sa bagyong Obet na po sa ating bansa. Thank you so much sa inyo po pakikinig at panonood ng In the Heart of Business. Ako po si Maru Pahati Sarne with my partner Lito Gagni at salamat din sa ating mga kasamahan sa DWIZ. Walang pangalan, Kim. Hindi mo na ibigay. Pero nandiyan ba si Juna Guba? Nandiyan ba si Fred Belamala, Abby Malanday, Rashid Locsin, Elaine Di Malanta and Kim, si Micah Cervanes at Jessa Barameda. Siyempre, maraming salamat din sa ating lahat ng mga tagasunod po dito sa In the Heart of Business. Susunod na po si Miss Loli Acosta sa Sulong na Bayan. Ako po mamaya babalik sa Radyo Klinika sa DWIZ. Pag-usapan natin trans fatty acids at iba pang mga nakalagay sa ating pagkain na nagiging dahilan po ng sakit sa puso. Si Dr. Luigi Pierre Segundo ng PHA ang ating bisita mamaya po. Maraming salamat. Bye!
In the Heart of Business, isang oras na talakayang pangnegosyo ang nakasama nyo sa pananghalian. Mapapakinggan Martes, Huwebes at Biyernes dito lang sa DWIZ 882 In the Heart of Business.